Hi guys, welcome to my channel. My name is Dr. Ngozi Onoha. I'm a trained internist and a geriatrician. I'm the founder of Health for Naija blog and the founder of this YouTube channel. This is an educational platform with the goal of improving health literacy and education. Thank you for listening to this presentation. If you gained value from this video, please subscribe, like, and share this video. Now, the disclaimer is that this video is only for education. It's not for diagnosis, evaluation, or treatment. So I'm going to begin the slideshow. All right, here we go. So today we're going to talk about falls, specifically in older adults. So these are people who are 65 years and older. So falls in older adults, this is caused by so many things. So when there's so many things that cause falls, we call this multifactorial. So many factors. And these factors can be divided into intrinsic and extrinsic. So intrinsic means internal problems and extrinsic means external problems. So a whole range of problems can cause falls in older adults. These include medications, different types of medications, including psychotropic medications, benzodiazepines, medications for dementia, and so many other medications. Blood pressure medications can cause falls. Diuretics can cause falls. The other problem that causes falls is frailty. If a person is weak and they're not strong, they have muscle weakness, which is also called sarcopenia, muscle wasting, or they have an acute illness, or they have a chronic illness, or they just generalized debility, they have generalized debility. You could also have environmental causes, which would be extrinsic causes. These include home hazards, so lots of carpets or poor lighting. Also, if they have vision problems, they can't see properly, then they will be at risk of falls. So degenerative or musculoskeletal problems, arthritis in the spine can cause falls, or foot problems. So this is sort of a broad overview. This is mostly an educational video. It's not to diagnose anyone, just to give you a broad overview of some of the things that can cause falls. Now, what do you do first? If you're seeing a patient with falls, you take a history. You want to know how this happened, where it happened, any symptoms with it, any chest pains, loss of consciousness, weakness in the extremities, any headache. So you're looking for the red flag signs. So anything that would let you know that this is sort of major, and then you need to do a little bit more in terms of identifying the cause of the fall, what led to the fall. So you do an exam. In particular, you want to focus on the sitting and standing blood pressure, because in older adults, they can't regulate their blood pressure. When they get up, their blood pressure may fall, and then they will feel dizzy, and then they may fall as a result. You want to check their heart rate to make sure they don't have any type of heart block. You want to do a neuro exam to make sure that the person did not have a stroke, a cardiovascular exam to make sure they don't have any kind of abnormal heartbeat or slow heart rate. Musculoskeletal exam, you want to make sure that there are no fractures anywhere, and then you want to check the gait. So lab tests really depend on what you find in the history. You could do general blood work to check for dehydration, to check for diabetes, anemia, a thyroid test, and then other tests depend on what you find again on the exam. If you find any cardiac indications, you could do an EKG, a cardiac echo. If there's been any head trauma, then a CAT scan, especially if they're taking blood thinners. An X-ray might be needed if they're having pain. Falls can cause hip pain, and they may need x-rays of the hip if they can't walk, they can't weight bear, or the hip looks rotated outwards, or the leg looks shorter. So depending on what you find on exam, you may need x-rays, MRIs to find out if there's been any injuries resulting from the fall. So it really pretty much varies depending on patient to patient. So what do you do? Solutions, you have to assess gait. So the test to assess gait, there are many tests, but a popular one is called the timed up and go test. And if you go on Google and just type in CDC, timed up and go, you will see the link that shows you how to perform the test. So you have a patient who's sitting in the chair, you ask them to stand from the chair and to walk 10 feet and then return to sit in the chair, and the normal duration should be less than 12 seconds. If this test is performed for 12 or more seconds, then this patient may be at risk of falls. At that point, consider strength, balance, and gait training. This can happen in the context of group or home exercises and physical therapy assessment for fall prevention. If the person has had recurring falls, then they need to have a fall risk assessment. This is typically performed by the physical therapist. So what can you do in the home to prevent falls? The presence of railings that the patient can grab on, grab bars in the bathroom, remove the carpets, and then non-slip floor tiles that are not slippery, and then improve the lighting so that visibility is better and then reduces risk of falls. So some more solutions is ensuring the footwear is appropriate, the right kind of shoes are being worn, because people might fall because they're having foot problems. Remember, having foot pain or ankle problems or toe pain. So the right footwear is appropriate. Treat any vision problems. If the person has cataracts, they need to see an eye doctor. Tai Chi is a very popular exercise in Asia. It's typically used for balance and strength. Vitamin D has helped in patients who are homebound and nursing home patients. They should be taking vitamin D 800 units once a day. And also, if a person has recurring falls, consider giving them mobility aid, which could be a cane or a walker or a rollator, and the physical therapist can assess the best mobility aid for that particular person. So this is our last slide, and I want to say thank you for listening. If you want to know more about falls and prevention of falls, the CDC website has a great tutorial there. If you go on Google and just type in the CDC study, and it will bring you to the page. There's a lot of content on there. You can take a course on there that's free, and you can learn more about falls, how to prevent falls, and what to do for people with falls. So thanks again for listening. This forum is just for education only. It is not meant to diagnose, evaluate, or treat anyone. If you like this video, please click subscribe, like, and share. Also visit our Instagram page at Health for Naija and visit our website healthfornaija.com. Thank you and have a great day.